Hi, I'm Evan Zautek. We're here today to talk about a rare type of blood cancer called multiple myeloma. Multiple myeloma is a type of cancer that forms in the plasma cells within our blood. Unlike most cancers, multiple myeloma does not exist as a lump or tumor. Instead, myeloma causes the abnormal and rapid growth of damaged plasma cells inside the bone marrow. These cells grow uncontrollably, interfering with the production of normal white blood cells, red blood cells, and antibodies. Myeloma affects the places in the body where bone marrow is most active, such as skull, pelvis, ribcage, and spine. Multiple myeloma is a disease which is most often diagnosed in individuals over the age of 60. The average age of multiple myeloma patients is around 70. Only about 2% of cases occur in people under the age of 40. My dad was diagnosed with multiple myeloma at the age of 45. Multiple myeloma has many negative effects on the body. The blood, bones, and kidneys are affected the most. Myeloma causes abnormal proteins to travel to the kidneys and bones, which can weaken bones and prevent the kidneys from doing their job. Multiple myeloma cells also overcrowd healthy blood cells production, which leads them to less carrying oxygen, less antibodies, and more infectious cells in the blood. Overall, the cells weaken the immune system, making the patient more susceptible to other diseases. What are the symptoms of multiple myeloma? Most patients with multiple myeloma experience bone pain, which is the most common symptom. Many patients don't feel pain in their ribs or their back. Myeloma also causes normal healthy bone to break down and weaken, leading to fractures. Many patients experience symptoms like fatigue, weak muscles, shortness of breath, loss of appetite, restlessness, and dizziness. Oftentimes, though, people with myeloma experience more severe symptoms like unusual bleeding through the nose and gums. Many myeloma patients become more infectious. The lack of oxygen in the blood or anemia can make the patient feel tired and weak. How is myeloma diagnosed? Myeloma is very difficult to diagnose and is often overlooked. A regular blood test, which is called a CBC or complete blood count, will not detect this type of cancer. Doctors have to perform very specific tests to properly diagnose multiple myeloma. There is a specific protein in the blood which doctors look for, and it's called M protein. The level of this M protein in the blood is an indicator of the extent of the cancer. Doctors will also measure the level of antibodies in the blood, which we typically see in the M patients, is when the M protein levels are high and the antibody levels are low. X-rays and other tests such as bone scans are used to help diagnose myeloma patients. Doctors will look at the bones to see if there are any lesions, which are holes in the bones. An MRI may also be used, which will allow the doctors to see the condition of the bone marrow. Usually the final test that is used to diagnose myeloma is a bone marrow biopsy. Doctors take a sample of the bone marrow using a long needle into the patient's hip. The sample is then analyzed and tested for myeloma. When my dad was diagnosed with myeloma, he underwent several blood and urine tests. He also had an MRI which showed some abnormalities in his bone. The last test he had was a bone marrow biopsy which confirmed his multiple myeloma diagnosis. When a patient is diagnosed with myeloma, the doctor will categorize or stage the disease based on the extent or progression of the cancer. There are 3 stages of myeloma. Stage 1, which is a low level of M protein in the blood, and no other myeloma defining symptoms, or what doctors will refer to as events. The amount of diseased plasma cells in the bone marrow is less than 10%. Patients may or may not show any other signs or symptoms. Stage 2, which is called smoldering myeloma. Here we see higher levels of M protein, and diseased plasma cells in the bone marrow is now between 10% and 60%. Patients usually start to show other symptoms. Stage 3, which is just called multiple myeloma. There is a high presence of M protein diseased plasma, which is bone marrow, in greater than 60%. And usually the patient has bone lesions or fractures. It is important to properly categorize or stage each patient, as doctors will prescribe a different treatment plan based on the progression of the cancer. What causes multiple myeloma? There is no known cause for the myeloma at the moment, but there are risk factors that can increase your chances of getting the cancer. Exposure to different chemicals, usually found in rubber manufacturing, woodworking, firefighting, or herbicides. M cells are made when there are genetic errors in the DNA of plasma cells. Family history of myeloma or plasma disorders can also greatly increase chances. How is myeloma treated? Myeloma has many different treatment options. One option is biotreatment. Biotreatment is when drugs are used to enhance the immune system to be able to fight off myeloma without any help. Another option is radiation therapy. Radiation therapy uses beams of energy such as X-ray and protons that damage myeloma cells and stop their growth. Another treatment option is chemotherapy. Chemo is used to kill fast-growing cells. It can also have a lot of side effects. Chemo can lead to hair loss, nausea and vomiting, and depression. This type of treatment is also used as the last step before a full bone marrow transplant. A bone marrow transplant, or a stem cell transplant, is a procedure where the deceased bone marrow is removed from the patient and replaced with healthy bone. Patients can use their own stem cells or stem cells from a donor. The stem cell transplant replaces the deceased bone marrow and reboots the patient's immune system. Can you prevent multiple myeloma? There's no known way to prevent myeloma, but there are ways of lowering the chances of getting it. A healthy diet is a very good way of keeping your chances down. Foods like cooked tomatoes, vegetables like broccoli and Brussels sprouts, fresh fish, and vitamin A will help to lower these chances. Many types of cancer diets can also help prevent with myeloma as well as other cancers.